Over the years, Nigeria has battled with high burden of HIV infections, but the last few years has seen significant progress in the fight against HIV and AIDS. The country has recorded a significant decline in HIV prevalence from 5.5% in 2001 to 1.3% in 2018. Presently, it is estimated that 1.8 million people live with HIV in Nigeria, of which 90% are aware of their status. The Global AIDS Strategy 2021 to 2026 and the 2021 Political Declaration on AIDS have revealed the reasons why the world missed the 90-90-90 targets, which had anticipated that 90% of HIV-infected individuals would have been diagnosed by 2020, 90% of whom will be on antiretroviral therapy, ART, and 90% of whom will achieve sustained virologic suppression. The COVID-19 pandemic that took the world by storm last year is, however, seen to have had dramatic consequences for HIV containment, with human and financial resources diverted, prevention programs compromised, and supply chains disrupted. Now, statistics reveal that 2/3 of all people with HIV live in sub-Saharan Africa, with data from UNAIDS showing that people infected with HIV have twice the risk of dying from COVID-19 compared to the general population. On this edition of Nigeria Today, we shall be looking at efforts towards ending HIV/AIDS in Nigeria. Welcome to the program. I am Lydia Odije Ochi. Joining me in the studio to provide insights on the topic is Dr. Gambo Aliyu, Director General, National Agency for the Control of AIDS, NACA. Glad to have you join us on Nigeria Today.
Thank you, Lydia, for inviting me.
Also with us here in the studio is Christy Lanion, Executive Director and Managing Consultant, Family Health International. You're welcome to the program.
Thank you so much, Lydia.
Okay, let me begin with Dr. Gambo. 30 years after HIV/AIDS was first discovered in 1981, would you say it is still a public health threat? Dr.
Yes,
Gambo.
Lydia, it is 40 years today. So HIV is still a public threat. It is still a global issue, and it's also a local issue. It's not yet under control globally. It's neither also under control here locally. But suffice is to say, tremendous work has been done, a lot of successes recorded, and the global community as well as the local community are on the path of controlling the pandemic. The 2030 target is looking very, very possible.
Okay. Now, Christy, how would you rate the impact of the COVID-19 pandemic on the fight against HIV and AIDS? And if I may add, what consequences did the pandemic have on global HIV interventions?
I'd like to start on a positive note to say that a recent study by the Global Fund showed that Nigeria is a success story when it comes to the impact mitigation for COVID-19. While COVID-19 has impacted on the general populace, the various systems and structures that HIV/AIDS programming had built in Nigeria provided the country an early response opportunity. Nigeria was able to use the community structures. I recall that Dr. Aliyu contacted me and said he needs information about the various community structures in my program, for instance. These community structures were shared with the NCDC, and so those structures were the early ways in which contact tracing, getting information about COVID to people happened. I need to say that because, you know, as Nigerians often would look at the negative first. However, the COVID-19 pandemic did disrupt the supply chain. A lot of the medication that should have come in could not come in. Production, even internationally, was affected because people couldn't go out to do the work. And so there were delays in receiving important medication. But it needs to be said that the early response, just like when it happened with Ebola, that Nigeria had to quickly do what we refer to technically as differentiated service delivery for HIV clients, ensured that the HIV infected and known clients did not come down significantly with the COVID, because COVID was attacking people who were already immunocompromised. So what we did in the DSD approach was to ensure that those who were on treatment got 3 months, 6 months medication and did not need to come to the facility. Within a very short time of around 6 weeks, we were able to apply DSD in my program to about 70% of those who were on our clientele list. So in that regard, we were able to forestall the effect or the impact of COVID on individual HIV positive clients. However, in the general population, COVID still impacted a lot of people because of the, how would I say it, we did not believe, just like we did with HIV, that the epidemic existed.
It's okay, thank you so much for that. Dr. Gamboali, the global target for ending HIV and AIDS remains 2030. How achievable is this?
Highly achievable. Here in Nigeria, we're looking at hitting that global target before 2025 latest. And we're looking at a window of 18 months to 2 years from now. We should be able to hit the roof in terms of the global target, which means identifying 95% of people that live with HIV in Nigeria to know they have HIV, and 95% of those who live with HIV and know they have HIV have access to life-saving medications, and 95% of those that have access to the life-saving medication have this medication working to suppress the virus. Once this virus is suppressed and is below detection, what happens is that it cannot be transmitted from the person that has it to one that does not have it. Second, it cannot continue to destroy the immune defense mechanism or the body mechanism that protects the body against infection and infestation, which is the mechanism HIV utilizes to cause what we call AIDS. Once AIDS sets in, you see sickness, and that is when it begins to show in the face of individuals that have it. And if treatment is not given and care is not given, that is the pathway to death.
In fact, while you were talking, I was just imagining how one would contend with HIV and AIDS and COVID-19 at the same time. Honestly, I shudder at the thought. Now, one issue that kept resonating in the discussion of ending HIV in Nigeria is that of funding. Now, Christy, how responsive would you say the federal government has been in providing the necessary funding to end HIV in Nigeria?
To be fair, as I said, to ourselves and to the country, the government of Nigeria has made a lot of effort in funding in recent years. I know that sometimes in 2020, before the COVID, Dr. Aliyu and I were in South Africa, and we were talking about the effort at putting about 100,000 people on treatment by the government of Nigeria, and the government came through with this. But this is really a drop in the bucket compared to the resources that the donors are bringing to help us in this fight. The way that I can maybe explain this is to say that 3/4 of the resources, 75% of the resources to fight HIV is coming from the donor and international communities. The resources that the country contributes in personnel and in the infrastructure that is already available. This is enormous, but it by no means addresses the cost of drugs, for instance. To put about 200,000 people on treatment for about a year, you would be looking at about something close to 100 million US dollars, about 80 million US dollars for about 200,000 people on treatment. And so when you consider that the treatment burden in Nigeria is 1.8 million, if we found all those who are infected. Currently, we've found about 1.1 million, and the number is increasing, which means we are doing well in terms of the testing approaches and case identification. But if the donor leaves, then we're going to be in trouble.
If I may interject here, why is it so expensive?
The drugs are expensive. We're not producing the drugs. We're buying in international markets. And it is a cost that the international market sells the drugs that we buy them from. Exactly. And don't also forget that these are lifelong treatments. Mm-hmm. So some people would take up to 60 pills a month, and about 30 pills a month. And when you multiply that in 36, in 12 months, the volume really is a lot.
It's okay. Now, Dr. Gambo, she's talking about states now. There is also commitment on the part of states to release 0.5 to 1.0% of their monthly allocations to support HIV response in their states. Have these states been able to redeem these commitments?
A very good question. But let me begin by correcting a statistic that has been given by Crystalline, and we have so far identified 1.6 million out of that 1.8, 1.9. So we are 500,000 more ahead of the 1.1 Crystalline calls. The thing to consider here is that I always want to give this example. If you look at 90% of the patients that were treated now that are receiving medication belong to states. 90% of the facilities where the services are provided, they also belong to states. About 90% of human resources for health that provide these services also belong to state. Where the disconnection happens is over 90% of the resources that are used in providing services do not come from the states. So, to be precise, about 80 to 85% of the resources that are used for HIV programming in this country come from the donor communities, largely the United States PEPFAR program and the Global Fund to fight HIV, malaria, and tuberculosis. And this is the nightmare we are having and working around. Now, for the next 1 to 2 years, we want to work hard to see that we have sustainability structures in place.
Okay.
Yeah.
Apparently, there's need for more commitment from the states. Now, let's take a break. When we return, there'll be more to talk about on COVID-19 and HIV/AIDS response. Please, do stay with us.
This is NTA News 24 broadcasting from Abuja. You can watch us anywhere, anytime on the following platforms.
Star Times Channel 191, Brick TV Channel 703, DSTV Channel 419, and GoTV Channel 436.
For more information, log on to our website www.nta.ng or join us on our social media handles, Facebook at NTA News 24.
For comments, suggestions and inquiries, send an email to news24@nta.gov.ng or call us on the following numbers.
NTA News 24.
News and more news.
Welcome back. If you've just tuned in, we have been discussing COVID-19 and HIV and AIDS response with experts in the studio. Dr. Gambo Aliu, Director General, National Agency for the Control of AIDS, NACA, and Christy Lanion, the Executive Director and Managing Consultant, Family Health International. Dr. Gambo, tomorrow, December 1st, the world will be commemorating World AIDS Day, and Nigeria has chosen the theme, End Inequality, End AIDS Through Sustainable Financing. What exactly are the issues around this theme?
The end inequality, the global theme is end inequality, end pandemics, which means end unequal access to HIV services, especially testing services and treatment services and prevention services, looking at populations that are marginalized, groups that naturally find it very difficult to have access because of the nature of maybe the lifestyle, or because they happen to be around the age group that are disadvantaged, especially if we talk of adolescents and young persons and who don't connect to the programs we do. They hardly watch this program we do on telly like this, but they connect via social media. And they find it very difficult to come and request or look for services, HIV services, simply because the age is below traditionally, and because of the consequences that may happen, you know, when they make that move. So, if you look also at population that are vulnerable, the key affected population that are at higher risk of acquiring HIV, as well as at greater risk of giving HIV to other people, do not have sufficient access to services, although we have made significant progress in the last 2 years. Okay. And the third one, for example, mother-to-child transmission of HIV. Getting pregnant women to have a pregnancy tested for HIV has been a problem. Every pregnant woman that register for antenatal services usually ends up having that pregnancy screened for HIV. But not all pregnant women go for antenatal services. Some choose or will choose to have traditional birth attendants attend to them. Some will choose to have a trained nurse in the community to attend to them, while some will go to religious places of worship to access services. What we are doing now, or will be doing for the next 1 year and 18 months from now, is to move to meet them halfway. Wherever we can find pregnant women who want to make sure that that pregnancy is tested for HIV, whether in the comfort of the room, whether them taking the HIV self-testing to do it by themselves and tell us the result, or religious places of worship, community gatherings, marketplace, wherever they feel comfortable to access these services, we want to access and give them. So the sustainable financing we're talking about here is that after we control the epidemic, what next? After we control the epidemic, we got to sustain it. Sustaining it means if we identify 1.8, 1.9 million people that have HIV in them in Nigeria, we have the responsibility of continuing to give them this medication for the rest of their life. If we want to make sure we keep HIV within these people here and keep it under permanent check and control.
Okay. Now, Christy, there are renewed calls for urgent action to end inequalities, stigma, and practices that perpetuate global AIDS pandemic. In what form do these inequalities present, and how can they be tackled?
So one of the key ways in which it presents, Dr. Gambo Aliu has already referred to this, is the lack of access. In fact, that is the key inequality, because even where testing services are available and people can't test, as he said, either because they're too young or they feel vulnerable or they feel they will be stigmatized, they do not use the services. And once they can't use the services, then there's inequality. Another way in which we can also talk about the inequalities is also the inequality that has to do with your social, with poverty. and that also still links back to access. People in very remote communities where the health services don't even get to, we need to get the services to them. And so if we're unable to get the services to them, then there's a lack of equity there as well. We also talk about the countries globally, the developed countries where the access and the resources are more available when you compare them to developing economies like that of Nigeria.
That's okay. Now, Dr. Gambo, how would you describe access to HIV/AIDS medication in Nigeria presently? Not talking about last year now. Christy already addressed that. And are we there yet? And if not, what needs to be done to create more access to drugs?
The simple answer to it is that we are almost there. There is tremendous increase in terms of access to not only treatment services, prevention, as well as the testing services. I will give you an example. In 2019, when we called for data, which means we want to see the names and the location where people are accessing services nationwide. We asked the Crystal Learning and other implementers to upload their data on our website, on our site, to see what we're looking at. And then we had about a little over 800,000 people that we can say truly on treatment, that we can see and we can count. Today, as I'm talking to you, we have 1.6 million on treatment that we can see and count. The opportunity, which was the blessing in disguise during the COVID response, was our ability to have integrated services, going out into the community looking for COVID-19 and referring them, and then testing for HIV, and also looking for tuberculosis. That afforded us the opportunity to come much closer to people at the comfort of the residence and engaging them and testing them for HIV, referring those that we identified to the nearest location where they can access services, and people agreeing to test for HIV and also agreeing to be referred to go to these centers and location to take this medication. What that tells me is that we are not only winning in providing access, we are winning in fighting stigma and discrimination. In the past, people don't listen and don't even accept to test. Now people accepting services and then accepting to get referred and accepting to remain in care, especially treatment. What I look forward to have next is people coming forward to demand for the services. Once that is done, then HIV is dead.
We shall surely get there, by God's grace. This is where we wrap it up on this edition of Nigeria Today. Our appreciation goes to our guest, Dr. Gambo Aliyu, Director General, National Agency for the Control of AIDS, NACA. Thank you for your insight on the program.
My pleasure, and thank you.
We also wish to thank Christy Lanion, the Executive Director and Managing Consultant, Family Health International. Thank you for being part of the program.
Thank you very much.
And to you, our viewer, we'd like to appreciate you for making out time to be with us on the program. Nigeria Today comes your way every weekdays at 7:30 p.m. Don't forget you can watch this and other editions on www.youtube.com/NTA News 24 Hub. I'm Lydia Ojiji Ochi. Thanks for watching. See you again tomorrow.